Welcome to the JEMS Report, brought to you by Clarion Events, Fire and Rescue Division, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the Editor-in-Chief of JEMS, along with Jeff Frankel, our Managing Editor. We are bringing you industry experts and leaders to talk about hot topics and new things in all areas of emergency medical services. Today, we are joined by two very special guests from EMS for Children. Dr. Kathleen Adelgais and Frank St. Denis. Thank you guys for joining us today.
Thanks for having us.
Thank you. Appreciate being here.
So to give our audience a little background about where each of you come from and how you came about EMS for Children. So Dr. Adelgais, would you like to start, please?
Sure. Well, first, thank you for having us. I am a pediatric emergency medicine and EMS physician, and I work clinically in Colorado at the University of Colorado and Children's Hospital Colorado in Aurora. And I've been involved with EMS for Children and the state partnership program of EMS for Children, but first in Utah starting around 2005, and then when I moved to Colorado in 2014. And EMS for Children, as a federally funded program, has many arms, one of which is the Pediatric Emergency Care Applied Research Network, which does research and is actually conducting 2 large EMS trials in children right now. And it has 58 state partnership programs. And the state partnership program managers and project directors are really the workhorses of EMS for Children, really working at the state and at the ground level to support pre-hospital and emergency care for children. So that any emergency care provider is really ready. And as an extension of that, we are here to talk about the Pediatric Readiness Program for EMS, or the PPRP, the Prehospital Pediatric Readiness Program, and the assessment that's currently ongoing. I also do work as the lead for that project, given that I serve as the pre-hospital domain lead for the EMS for Children Innovation and Improvement Center.
Well, just like every other physician that's involved with anything EMS, there's you've got a ton of stuff going on.
Yes, exactly. Wear a lot of hats typically, yes.
My name is Frank St. Denis. I am been in EMS now for about 31 years now. We're coming up on. I currently serve as the EMS Division Chief for Lenoir County, which is a basically rural community in eastern North Carolina. Like I said, I've been doing this now for about 30 years. Been in this position now for a couple of years. Previously, careers, paramedic firefighter in my younger days. Have moved up through the ranks of, various EMS facets, including flight medicine and what have you. Still serve as adjunct faculty and affiliate faculty with the NAEMT, as well as doing some teaching for our local education institutions here. I got involved with these guys. I took the opportunity to get the early assessment done as part of this. And then upon completing that, they kind of reached out, we developed a dialogue, and then they've asked me to kind of jump on board with them to help get this word out. So this is how I come to these guys now.
Well, that's great. Well, thank you both for, like I said, taking time out of your busy day. So for the audience that might not know, what is EMS for Children, and how does it interact with, you mentioned federal and state, and how does it impact the daily provider?
Thank you for that. So as I had said, EMS for Children is a federally funded program, and it has many spokes and arms to kind of really reach at every level across education, research, advocacy, and actually just best clinical practice, and get that information really disseminated out into the hands of emergency care clinicians across the continuum, starting with EMS and extending through even physicians working in emergency departments, nurses, respiratory therapists, and others, mental health experts, so that they kind of have emergency care recommendations for all children across all levels of severity and throughout that emergency care continuum. EMS for Children has been a program since 1984, funded originally by Congress, and it's had continuous funding since that time. The series, the initial work of EMS for Children was to provide grants to states and others for a series of demonstration projects to kind of see how this works. And that has really evolved into a very comprehensive program that is present in all 58 states and territories, funds a large coordinating center, funds a large data center, funds a hospital network that has actually really published the preeminent articles and evidence and research on how to care for children in emergencies. And then also finally has funded some variety of different smaller projects to kind of, again, help with that evidence generation and that evidence translation into the hands of clinicians. In the EMS world, I'll speak about how it's very nascent. We have been doing pre-hospital work to assess what frequency of EMS agencies in the state had access to pediatric care guidelines, both online and offline, and what percent of EMS agencies had all the recommended equipment. We've now moved forward to say, all right, so what percent of agencies actually do active pediatric care coordination? How frequently do EMS agencies do skills checks with pediatric equipment? So to get a little bit more granular and a little bit more functional in the day-to-day operations of EMS. And the other key thing about EMS for Children is that through its PCARN research network, it has brought EMS into the research enterprise so that studies can happen of children who require emergency care. And that can, again, ultimately translate into this is best evidence and best practice for what EMS clinicians should be doing for seizures, for airway management, for agitation, and other things like that. So we have resources on the EIC website with homegrown educational products and data and information that EMS agencies can use right now to help with their pediatric training and their pediatric readiness. I'll leave it at that as what EMSC is for me, but Frank, I'd love to hear from you, having done the assessment and then other things, what you've kind of learned more about EMS for Children from your perspective.
Sure. Yeah, initially the EMS for Children thing was something that was a little bit unknown to me. As we talked about, I got a random email one day that said, hey, try this assessment. And I kind of jumped on it. And then I think we've taken off with this ever since. But for us, it was a very eye-opening experience to get introduced to this system and what these guys are all about and what they're promoting and pushing for pediatric readiness. Taking the assessment for us, I think with any assessment, you go through this process and you're worried about, gosh, did I answer that question right? Am I going to get the right score? How am I going to feel about ourselves after we're done with this? And what it's really set us up for is a whole new outlook for us about where we are going with our education and what we are ready for. And the other thing that has helped us is, as I mentioned earlier, we are a rural community, so we're not as fortunate to have the large budgets like some of our major metropolitan areas. So this has given us an opportunity to look at what can I do with the resources I got that still is going to make things better for our pediatric patients. The resources that these guys offer on their website are absolutely invaluable. As far as from education standpoints to different resources to pursue some opportunities. I've been lucky enough to get in touch with a couple of different people where I've recently been able to get some grant funded equipment funneled to us. And it's just been a great asset for us. And it's definitely something that we're looking forward to even more. Currently we use it, my training officer and I, we go through this assessment pretty well in detail, and we've been trying to really figure out what do we want to hit first, where are we going with this, and through our medical director and stuff, been kind of using it as our guide to define protocols, revamp our protocols, or just our education in general about where we want to go and how we want to get there.
So really quick, I mean, we've got the new project. Of course, you said that this program or these programs have been active since 1984, so they've been around for a while, and of course, been creating quite a bit of resources on your website. But the Prehospital Pediatric Readiness Project specifically, there's a toolkit that is part of this. I'm sure, Director, this is one of the things that you were mentioning as far as a resource on their website. And this isn't an accreditation type thing. This isn't a punitive type thing. This is all informational for, as you mentioned, readiness for services to kind of do a self-assessment to see where they are and maybe where they rank. Is that what the angle of this is?
Yeah, so the National Prehospital Pediatric Readiness Project is this large project that really involves a steering committee that provides oversight to things. We created initially a checklist as kind of this quick self-assessment that EMS agencies could do. And the checklist was based on recommendations out of a joint policy statement that was co-published by the American Academy of Pediatrics, American College of Emergency Physicians, ENA, the Emergency Nurses Association, and AEMT, the National Association of EMTs, and the National Association of EMS Physicians, really delineating what were key things based on the knowledge and evidence that we had at the time would make an EMS agency considered ready for children. And this is a corollary to a lot of work that started 2 decades ago to support emergency departments being ready for children. And we took those initial recommendations and we've translated those into this large national assessment where when agencies complete the assessment, they actually get a readiness score. And I think one of the things that is intimidating, as Frank just said, is, well, what if my score is bad? We have no idea of the state of readiness among EMS agencies to care for children. We don't know if it looks different if you're BLS or ALS, if it looks different if you are rural, volunteer, municipal. And so we're getting the very first picture of what that looks like. And then again, that only helps us to ultimately develop more resources and really target where things are going. So an agency like Lenoir County does the assessment. Oh, we don't have good family-centered care policies. And I'm just throwing something out there. I don't know if you do or not. And so that's an area that's a gap. Where do we go to find a family-centered? What does that look like for EMS? And that's what the toolkit is for. So the toolkit has on the website has educational policies, procedures, best practice recommendations, even medication recommendations for certain common clinical conditions. It then, it houses resources that people can then pick and choose from if they need. And the key thing that we want to reassure people about is, again, we don't know the state of readiness. This is to help us help you. We do know that readiness in hospitals translates to reduced mortality, and we'd like to think that that's true in EMS as well, but we have a long way to go to figure that out, but we can't even begin until we kind of know where we are.
Right. So in layman's terms, for me, this program is the starting point or the foundation, for what the future of EMS for children could possibly work on.
Exactly. Yes.
So what types of agencies are you looking for to be part of this? You mentioned a few, during this conversation, but specifically, who are you looking for to enroll or be part of this project?
We're looking for all 911 responding ground agencies, so fire and private municipal third service. If you are a ground ambulance responding to 911, we're hoping you can do the assessment. It does not matter if you're volunteer. It does not matter if you're professional. It does not matter, if your agency hasn't seen a kid in 5 years. We want everyone to complete it to get the best picture of the state of readiness in our country. Right now, we've not been directly soliciting interfacility transports or aeromedical. That will be in the future. Those obviously function a bit differently. We're looking about, for when a family picks up the phone and calls 911, who's going to respond, who's going to see them and get some information there.
So you mentioned fire and EMS, professional or paid service versus volunteer. Do they have to be transporting services, or are they first response as well, non-transport?
First response, non-transporting as well.
Okay. So with this, and before we get into more specifics about it, what's the remaining time frame of the project? How long does it take to do the service part of the survey, things like that?
Frank, do you want to speak to your experience in completing the assessment?
Yeah, for me, the assessment, it took me about 45 minutes to do this. There are a number of questions. Most of them are pretty straightforward and easy. There were a couple that I had to look up afterward or during the course of the assessment. So if I was to give anybody any advice prior to them sitting down to do the assessment, it would be to research your calls, know how many pediatric patients you transported or treated, and then just be familiar with what your call volume and your demographic is. But overall, I would say as long as you have those numbers up front, 30 to 40 minutes at most probably to do the assessment. And like you said, the information I got out of it was absolutely invaluable. It really helped us tweak some of our education aspects, but I think the big thing that the doctor has talked about was our family centered care and our communication with our hospital. Again, being rural, we don't have the luxury of having a major hospital here. We're very much a tertiary care center with, basic stuff that we come in, stabilize the best we can, and then they are shipped off to our regional trauma centers or other specialty care centers where we don't have those, the luxury of all the services. So a lot of times it's a struggle. But we've been able to work with some of the case management people at our local hospital and really start to look at how to become more family-centered care oriented and how we can make that transition of coming to this hospital and being transferred to somewhere else. How do we make that better for the patient and the family members and stuff? But the assessment itself is absolutely invaluable. It was probably one of the better 45 minutes I've spent in a very long time to try to get this done. And like I said, the report, when you're done, it comes out, it always sits right here on my desk. It's probably about 15 pages long. It gives you your score and then breaks it down to all your sections so you can reference your results back later, but absolutely invaluable resource.
And the assessment is going to be open until the end of July, so until July 31st. It's been open since May 1st. Right now, nationally, we have a 33% response rate. Given that non-transporting and all EMS ground 911 responding agencies are eligible to complete the assessment, that we're looking to assess like 15,000 EMS agencies nationally, so a very big number, and so we're hoping that we're so grateful for your time to kind of advertise about this, because we've just got about 3 weeks left to kind of get people on board to doing it. They can go to EMS Peds Ready. It's a website. If they type that in, it'll pop up very easily. And there's a box where they can actually download a paper copy of the assessment. So as Frank was just talking about being able to be prepared for the assessment by knowing what you're going to have to answer questions to, people can get a preview and see that. So it can look daunting on paper, but there's branch logic. So if you click no on something or click yes on something, it might just move you past several questions. And so it doesn't take as long as it would look like necessarily on paper.
Great. So about 3 weeks. We just did a press release on JEMS for this as well.
So thank you.
that went out yesterday to try to help get the word out for this. So when are you anticipating the results of this research project being completed and information going out to the wide audience?
Yeah, well, so we want to be clear that, in the future, there may be some research done with some of the readiness scores. However, this itself is not a research project. It's really going to be used by our state partnership program managers, those individuals in every state and territory who work with EMS agencies directly to support their care of children. The information that we glean will really drive the next efforts by the EMS for Children program on where are the gaps and where do we want to work. The data that's being collected is confidential to the EMS agency. So when the EMS agency gets that gap report, they see it. But the data does get housed in the EMS for Children data center. State partnership program managers will also be able to see the information. They may directly reach out to agencies, seeing that an agency completed the assessment, and then offering resources and support and saying, hi, I'm here. You probably didn't know I exist. Which is the case which is true in many cases here, even in Colorado where I work. And then the EMS for Children data center is going to compile the information stratified by type of agency and other things, and then be able to get that information back to our federal funders so that they can also see, where do they need to prioritize their funding to support EMS.
That's great. So getting just a little bit more kind of granular to some of this, Director St. Denis, what are some of the takeaways that you had that were kind of operational or actionable from this? You said that it's a big resource, and of course everybody knows, those of us that have worked in EMS for a long time, kids just scare people. You don't get a lot of practice with them. You're not really comfortable with it. Yes, we used to do the Broslow bag or the color bag, and that helped with some of the stuff. But it was still always, kind of a daunting task when you had a pediatric patient that really wasn't a simple call or a routine call. So what are some of the takeaways that you got that were actionable from this?
Yeah, I mean, some of the takeaways were we used a lot of the training opportunities that were presented on the website as part of the toolkit. Like you said, we've had this feeling every single time, oh my gosh, it's a peds call, everybody's freaked out, they're worried, whatever. There's been many times that I've shown up on calls and they're like, oh, thank you for coming because, we're so scared or something like that. But some of our actionable things have just really been taking the training opportunities that have been presented on there and rolling them into our continuing education. We've actually kind of changed our continuing education schedule around a little bit to kind of center on the PEDS thing because we've had a couple of those calls where they said, oh my gosh, I was so scared. I wish I knew this or I knew that. And this assessment's kind of fallen in line where here's your assessment, here's these tools you can use. And we're using this to help educate. And as a matter of fact, anytime we run across a call now or a situation now and people are asking questions, I'm kind of guiding them towards that website to actually access. I'm going to answer your question the best I can, but here's a bunch of these guys who do this stuff all the time, who've got this down pat that can really answer all those things or might spur you to come up with something else. And plus the different contact information to reach out to people for additional resources is absolutely invaluable. So it's definitely something we put into our everyday operations now as far as our QA/QI process and just our general education.
Well, I think that's one of the things that, from looking at it from the outside in, that is so positive is that it's not just about, well, how are you guys doing? Okay, thanks. It's how are you guys doing? And here's a bunch of resources to help you along the way. In my past careers, I've had some interactions with EMS for Children in North Carolina and South Carolina and the programs that they've worked through, and I always had, great opportunities with especially educational aspects. So, it's nice to see that that's continued on and that, there's more resources for, the rural. I grew up in EMS with a lot of rural departments. And, those are the ones that are always struggling to find resources or to find help, and to have one more big resource is just a godsend.
And I think one thing I was going to, piggyback on was, when Frank was talking about how he's got his document, 15 pages kind of on his desk that he goes back to, that's the gap report that gets generated. So when an agency completes the assessment, they not only get a score, they get actually benchmarking of their score against other agencies of similar volume, similar pediatric volume. And when it's something that's, you don't see often, it's uncomfortable. We're really about supporting the prolonged resilience of the clinicians in the field, getting them to feel comfortable, getting them to feel like they have the right resources, they have the right training. Even if they don't see it all the time, there's already, something that they've practiced, or a policy or a protocol that they've been trained on, and that they know what to do. And I think that that's really the goal.
And that's great. So again, I want to thank you guys for taking time out of your busy day. A wonderful project, and something that helps services and of course the community for sure.
Yes.
Anything in closing? Anything that you'd like to nail home on the message before we wrap things up?
I'll speak first just to say that I really do encourage everybody, take the time to do this. It really, for the 30 to 40 minutes is going to take you. I know for us as an agency, it's been absolutely eye-opening and changing for us. It also was a little bit of reassurance. I talked about that score that you get, and you're nervous about what is my score going to say about me. And actually, our score said that we're kind of on par with the rest of our other peers and colleagues in EMS. So it was a little bit refreshing to know that, we are still doing the right things, but it gave us all these opportunities to make improvements in our system and for our patients. So by all means, take the short period of time it really takes to complete the assessment.
Thanks for that. And I would also add that if you're hearing this podcast, ask your chief, ask your EMS agency leadership, hey, did anybody from our agency complete this assessment? Because it's not being done on an individual EMS clinician basis. It's being done, at the agency level. I also really do want to put out there that we are living in a time where EMS really is at the face of public health, public safety, and are on the front lines doing so much for so many. Right now, there are fires in California, there are hurricanes in Texas, and we know that our agencies are stretched so thin. And so we're grateful for everything you do every day. And we're grateful for any time you can give to do the assessment, but we also do want to make it clear how much we value, the service you provide to your communities. And so I just want to thank you for giving us time to talk about this today.
Yes, of course. So just a reminder to everybody that's listening, July 31st, just under 3 weeks away, is the deadline for the survey to be completed. Once again, thank you very much for taking the time. We're very interested in hearing more information from you guys, and we're looking forward to articles and press releases, and maybe some more podcasts on children, because as everybody knows, children, it's an interesting call volume, and everybody never has enough information or enough practice at it to feel comfortable doing it.
Thank you.
Yes, thank you.